When I started this position back 10 years ago, I was surprised how much documentation or lack thereof influenced quality reporting.
I think we are always in the process of continuous improvement, and we have to keep our foot on the gas. So we have made a significant move in the area of documentation, and I think much of that is a result of explaining the why behind the ask. And our physicians and providers have really started to come on board in that understanding.
So moving forward, we need to continue to focus on documentation improvement. And part of that is education, certainly onboarding of physicians. As physicians and providers, we get very little education on the impact of our documentation. So one of the things that I started is creating some video presentations about reimbursement, about quality. My latest one is documentation, what every inpatient provider should know.
Some of the ongoing efforts we have that help our providers stay current with physician documentation and provider documentation is a lot of education that comes from our physician advisors. So I have to say that Dr. Pilger and his team do a fantastic job of creating videos and information to share with teams. He's happy to do grand rounds, happy to do one-on-one conversations, happy to meet with teams, but his videos are quite entertaining, but that entertainment really keeps teams engaged and interested in what he's presenting, so they make things clear and concise.
We work to ensure that clinical documentation improvement stays a priority for the organization through the metrics that we collect and that we distribute. We know the measures, and we report those out to the appropriate service lines so that they can continue to monitor their performance. Within some of our groups, we actually have value-based incentives around answering queries. So CDI queries and coding queries are very important to us.
Some of the safeguards is certainly our CDI team, our CDI specialist who review charts. I mean, the goal of any chart, documentation of a chart, is to make sure that every diagnosis that was monitored, assessed, evaluated, or treated is accurately documented in the medical record. The other thing, we certainly have an initiative going on now with a company called Modus One.
Specifically for hospital medicine, they've engaged with Modus One this year, and so that has been a direct opportunity for them. So they are able to look at those charts in real time and then give them direct feedback on a case-by-case basis. So looking at charts, these are the opportunities we're seeing that you're missing, specialized and personalized to that specific provider.
You can paint the picture of how sick the patient is in prose, but you need to paint by numbers. And again, those numbers are ICD-10 codes. You may be a physician that gives high quality of care, but the only way the rest of the world's going to know that is by documentation.
We are constantly working to make sure that our providers are up to date on these documentation changes. We'll meet with that specialty and review their recent performance and where there's opportunity.
So I think just being always in the mindset of continuous improvement, working towards zero to be a high reliability organization is what we want, and anything less than that, we will continue to work towards. So I think that we are always raising the bar. And I think that that's what people have come to expect here.
I know, being here 30 years, that we're providing excellent care, but I think it's important to get credit for it. And the credit is based on your documentation.